with us a very eminent practitioner, Dr. Gayathri Vyavhare. She is a pathologist by profession. She is practicing in Badlapur for the last 20 years. We have been associated with each other for many years, and today she is here with us to share her experiences with homeopathy. So welcome, Dr. Gayathri Vyavhare.
Thank you, Dr. Gajanan.
And since we know each other and we have exchanged patients and you have some experiences with us and homeopathy, I would like you to describe your whole journey with homeopathy especially, and what was your experience when you started homeopathy and before that.
Okay. My first interaction with homeopathy came after I was Dr. Gajanan's patient. And this happened, almost 20 years back. This was post-pregnancy when my asthma aggravated. That was the time when I was introduced to homeopathy, and I had heard about Dr. Dhanipkar, and that is how I came to him. And it was a very good experience. Something which I had been carrying out, a chronic disease which I had been carrying for almost 10 years, was arrested, and yes, there was cure for me in that way. Initially, I would require a pump every 6 hours or sometimes more than that, or every hourly also. After treatment with Dr. Dhanipkar, the pump is gone out now. It is no longer, I do not use any inhalers anymore, and it is only when I come across organophosphorus, that is the triggering point, I have to use something like behun or some very strong smell or some agarbatti which I am not used to or I am allergic to. Otherwise, I don't have to use the pump. And more than myself, my daughter Prerna, she too was his patient right after birth. She was a very colicky patient, and she was very resistant also. Now see, over here we have two types of way. One dealing with a physical ailment, and the second with a mental ailment. And her journey for the first 3 or 4 years had been so good that the colic went away. Also, her diet improved after that, and it was very surprising that Prerna, till she went to 8th standard and 9th standard, never felt seriously ill. She never missed school. If ever she had any seasonal illnesses, they would last only for 2 to 3 days. That was the level of immunity she had developed after taking homeopathy. Unfortunately, there was a gap of some 5 or 6 years after that. Visit Dr. Dhanipkar. I was busy in my practice, and again there was a resurgence of symptoms. For me, it was perimenopausal and menopausal with a plantar fasciitis and bone pain, and for Prerna it was teenage problems and psychological problems also, which came along with the teenage issues, adolescence. So she was having a very difficult time. Again, the resistance had come up, but now she couldn't express the resistance, because when she was small she could, and now she was subdued because of that resistance, and she was becoming more and more of an introvert. As far as the physical aspect of it was that she was developing a lot of pimples and blemishes, and that was bringing her confidence down. And when we started treatment, today if you go to see Prerna, there is absolutely no blemish on her face, and there are no side effects also. If I had gone for a laser or something like that, it would have, the skin would have been damaged. I don't know what would have happened, but it was a very gradual change in her skin, and this change came from inside, and that is exactly what I experienced when she was small. When the change to the colic, when it went away, and she never had colic after that. She never had a stomachache after that. And in the same way, but now what she has gone through is again the same thing. The skin has cured from inside out. And that was my experience with homeopathy, is when it goes and targets the issue, the actual issue or the actual problem is targeted, and from inside out there is healing. And that is very important. I, as a pathologist, have seen so many recurrences, people coming to me, mostly thyroid patients or say autoimmune patients. And when I myself landed up with something like plantar fasciitis, which was recurrent of course, and I was not responding to any type of treatment. Getting up in the morning was difficult, putting my foot down was difficult, and now when I wake up, there is no sign of plantar fasciitis, no sign of leg pain left. So this transition, which I saw in myself also, and I saw in Prerna also. In fact, Prerna's lifestyle has changed so much, it has become so clean, that if you see 21, 22-year-old children today, they are, their diet is not correct, their habits are bad, but Prerna has gradually changed in that aspect of it. So I feel homeopathy is one type of pathy which changes you from inside out, and that's where the changes come.
If you remember our conversations during case taking, we used to ask a lot about your state of mind and the things that affected you, for that matter your child also, and that is something very different from what the modern medicine is. There we understand only the symptoms. Here we were trying to understand how such emotional situations affecting you, your reaction to situations. Do you think it makes a difference in you after getting treatment, those emotions still they remain the same, or you feel there is a transformation within you as a person also?
This is something so beautiful, When you ask the questions, I used to feel, why is he asking me that? But when I started giving you the answers, actually I was thinking also at the same time, right? When I started giving you the answers, that burden, the psychological burden of that thing, got released, gradually. And then, obviously, then I never thought of it in that way. And whenever I would have an attack again, you would elicit the same psychological behavior again. And then automatically I started thinking it in that way, and I started minusing or dividing those experiences from my life, and I gradually increased. So yes, definitely the questions which are related to the psyche are more important, because your mind controls your body.
Yes, body.
And that is how it works.
And incidentally, you have been a co-author to most of my books also. The two of the books which I have written on thyroid and fever, you have been a co-author in.
It was a second learning for me, when I went through fever and all. So even I came to know, yes, these are the modalities which are available now. And thyroid, I myself am a hypothyroid patient under control, of course. So even I came to know a lot of things after that. When I went through all this, I started understanding my patients much better.
We have been interacting regarding the action of the medicines also,
yes.
How homeopathic medicines act, and we had a long conversations about this. So many times I used to tell you how the physiopathology of the medicines and the course of action becomes so important, and how we understand the patient. If you have found some experience regarding that, like the way we understand homeopathy, can you highlight something on that?
Oh, sure. This is such a nice question. See, when I was teaching in a college, I was teaching here, and I went through the latest edition Robbins. And the latest edition of Robbins says everything is molecular, and whatever you deal with is also at molecular level, because your medicines at a very minute level, they are just what you call dilutions at a very higher dilutions which go and act. So that at a molecular level, and your medicine at a molecular level. Second is, when I went through certain papers, especially related to inflammation, I found out that whatever drugs which you use have got same chemical, what do I say? They have same chemical structure to that receptors which are present on our cells. So, but obviously, your medicines could make a much more huger impact.
We have given some evident papers also about the research here.
So, and if this is a real good, see, if there is investigation going on in other countries regarding this, definitely homeopathy is a much more evolved branch, and it is not just what other people call it, meaning it is a game of luck, you give a medicine and it works. No, it is not that way. If it is dealt with properly, and if it is dealt with the right person, deals with the patient correctly with it, he can definitely point out the symptoms, and not only treat the symptoms but actually treat the disease and prevent the the complications of that disease. That is how it is.
Thank you. This was very important, because understanding it from the modern medicine perspective for a homeopath and to the homeopathic fraternity and the patients, it is really helpful, because it becomes evidence based. Today, when we are actually striving to prove that how homeopathy can be evidence based, your testimony or your perspective to look at homeopathy becomes important. Now, if you see that we give medicines in pills, and people say that how that pills will cure, and many times you may not find the sense of medicine in it. But when you take it within you, how fast you see as an experience, because there is a myth that homeopathy takes time to act. In acute conditions, you may not have to take homeopathy, and you have to resort to the modern medicine every time. But do you have an experience like when you have taken homeopathy in acute conditions? Did you have any kind of experience regarding that?
Yes, I have many experiences, especially when I used to have sinusitis and I have a nose block. I was prescribed, I remember the medicine name. And the second is I'm allergic to something in the kitchen, especially the asafoetida. And I start sneezing the moment once that goes into when you simmer something and if you put asafoetida, I start sneezing a lot, that's an allergic reaction. And I was prescribed sabadina initially also for it, and now also when I have that episode, immediately that rhinitis immediately stops, the sneezing immediately stops. This was not only respect to that, it was Prerna's colic also. Whenever we gave her Macforce, or I don't remember the other drug, her pain used to subside immediately. My plantar fasciitis pain, that also could subside immediately after medicine. The next morning, I used to take the medicine and sleep. So the next morning, I never experienced pain. I never had a problem walking also. That is the pain. So it's a myth, it's only chronic. It can be used in acute conditions also, provided the person giving it has to be an astute in this.
Thank you. What message you would like to give to patients who want to seek homeopathy?
See, firstly, let me tell you that homeopathy was the first pathy. The people learning medicine, they went into homeopathy. So definitely a knowledge of medicine is more important, and then they went into homeopathy. And with homeopathy there has been research, a lot of work has been done, people don't know about it. So if you just cannot sideline homeopathy. If you are going to look at a disease in the form of symptoms, and then you want your symptoms to be alleviated, you have a fever and you take a paracetamol and your fever is gone, fine. It's not that much. It is more beyond that. Why was the fever? What was the cause of it? There will be definitely 10 different causes for it. Your personality also tells how you're going to express the fever. So I think so homeopathy is the only branch which takes this into consideration. So if you are going to take homeopathy, you have to come with a lot of patience, you have to come with an open mind, and you have to move your body also very well. So when the doctor asks you, how do you feel, or what is the feeling XYZ symptom, you must be ready with it. You must know. Actually, homeopathy taught me how to understand my symptoms properly. If it is an anger issue which has led to it, or is it fear that has led to it.
Man in the body is also sick. So when you fall sick, there is a change in the personality as such. You react differently even to the same disease. That is what we consider. Many times our questions would have been like this, that what is the change that you have seen in your emotions since the time you are not well. So now so many years you are with us. Do you feel there is a change in the persona that you have? Your awareness has changed, or the way you look at things are better, or different, or still the same, or they need to be worked upon? What is your take on this, that it has helped you as a person apart from the symptoms?
Yes, it's definitely helped me as a person in my thinking. There are certain things I used to cling on to, and then that would lead to the symptoms. Now I know this is going to cause further problems inside me. So I know how to keep it aside and walk through the whole thing without being affected by it.
That's a very good and a very nice change, because we always believe that the things around you will not change. What needs to change is you need to see things differently and let it not affect you. I think this has been the most positive effect that we have seen with many patients, and you are a testament to it. Thank you very much, Dr. Vyavhare, and it was a pleasure talking to her, and best wishes. Thank you very much.
Thank you very much. I actually owe my health and my mental stability to you.
Thank you. Basically, it's to homeopathy.
It's to homeopathy, which works for you.
Thank you.